Hello everyone. Do you have sore throat? And are you confused in between steam and gargling? Then here is the video for you. In order to know anything, let us all go back to our olden days and let's remind what our elders used to say whenever you have sore throat. They used to say that gargle with the hot water, and doctors used to say that take the medication or steam or gargle with a betadine or hot water. So what you have to do? We are still confused. Still, it's a question mark for so many people. In order to know anything, in order to decide what is right, what is wrong, let us all do a groundwork, a basic work where we let us all know what is sore throat. Sore throat occurs due to any viral infection that is entering from your nose to the throat, or it remains in the throat and creates pharyngitis, or a bacterial infection due to which it makes it creates a sore throat and irritation, cough, mucus, persistent voice change qualities and all, right? So what you have to do whenever you have a sore throat, do not take your own treatment, but still we have to, in order to take any sort of decision gargling or steam, first let us know what is the procedure of gargling and what is the procedure of steam. Procedure of gargling is like we take one glass of hot water with 1 teaspoon of this salt, or betadine gargling. If we do a half cup of betadine and with remaining half cup of with water, we leave the water in our throat or in the mouth and we gargle. We create a sound. The air from our lungs that generates agitate to a throat, and that creates the bubbles in the throat, in our throat, and with that vibration and with that bubbles, the virus or a bacterial infection which is remaining, the mucus which is remaining in the throat will get clear, and the blood, and because of the salt hot water, that allows the blood flow, improves the blood flow in the pharyngeal phase, so that's also clears the bacteria subsequently. So whenever we do a gargling side by side with the pressure of the air which is created from the lungs, and the sound and the bubbles which are generating because of that, in that process in between there is a vocal cords, a voice box which is called as, so the vibration of vocal cords will be very high. It speedily vibrates, because of which at times your voice also will get changed. So it is very important to take care and know that if you have any sort of voice changes whenever you're doing gargling and all, do stop the gargling immediately. Okay, and then if you go for the steam inhalation, take a 1 bowl of hot water and add to a tip of Vicks or any medication or haldi or salt or e-capsule into it, and down your head, and then close and steam. Inhale it from your nose and exhale it from your mouth, and do it for 5 to 10 minutes. And gargling is for 2 to 3 times of gargling with a low intense voice. Okay, so this is generalized procedure. How do you decide? You have to take steam or you have to do gargling. So in order to decide anything, again we have to go back to the sore throat. We have to see whether the sore throat is because of the infection or is it because of the non-infection disease. So most of the sore throats are infectionated. That creates the mucus in your nose or in the throat, in throat or in the lungs, and that creates the throat pain, that creates sometimes dryness in your throat, that creates mucus and cough, and that creates persistent fever and pain while swallowing and voice change, and it has heavy, at times after immediately you cannot talk and you have heavy breathing pattern. So if you come back to the non-infectionative sore throat are like allergic, it is because of some allergic related issues, or is it could be because of dust or pollution, smoke, or any other anti-allergic medication, drugs, or it could be because of any over alcohol consumptions or dryness in your throat sometimes. This could be a non-allergic infection related. So now when you know that it is because of the infectionated sore throat, then gargling will be the best option for you to do it, because it acts very good. It clears the mucus in your throat, or it also clears the secretions or inflammation which is created because of this fungus. So that reduces the inflammation, that clears the mucuses, that reduces the pain, that moisturizes your throat. At the same time, it also has a drawback that creates the vocal cords vibration very speed, because of which your voice change will also take place, and heavy voice and overused voice will also make your voice more worse. And that is the reason at times whenever we have throat infection, your voice will get down, your pitch level will get down. So and when coming to the non-infective sore throats, in that it is highly recommended that you have to go for a steam inhalation, where you inhale the hot water vapor from your nose to the throat. So it creates, if you have any sort of mucus in the or infection or fungus in the if it got stick at the wall or corners of your nose or throats of your nose, that creates moisture, and that creates clears the airway passage free. It creates the free airway passages. So what are the advantages, what are the benefits, or what are the disadvantages for both of this are do not gargle over excessively. If you notice any sort of voice changes while doing gargling, please do stop gargling. If your sore throat is not cleared within 2 to 3 days, do consult the doctor. Whenever you're gargling, do not overuse your voice. Try to do it for a fraction of a second with maximum repetition times. And whenever you're taking a steam, inhale from nose and exhale it from mouth. And do it only for 5 to 10 minutes. And it is recommended for the patients who have non-infection sore throat conditions. And at times the gargling is also good, and in some cases it is also not recommended. Now I hope you all know when you have to do gargling and when you have to do steam, and how you have to protect your vocal cords. Not all sore throats will get cleared or recovery only with doing gargling or doing it with hot water or betadine or taking steam inhalation. If it is not getting cleared in 2 to 3, please do consult your doctor. You need certain medication, let them see, evaluate, then you continue with all the precautions whatever they have recommended. Till then, protect your throat, stay safe, and maintain your vocal hygiene.